Back in studio this week, we have the amazing Rob Main with Rob Main Health and Wellness here to talk to us about Medicare. Rob, thanks so much for coming back. Everybody gave you a bravo on your last show here, and so we're thankful to get educated on Medicare.
No, I appreciate the opportunity. Thank you for having me back. Hi, Randy. Thank you again for having me back.
Good to have you here. Absolutely.
Thank you. Yep.
So Medicare is a kind of a messy instrument that when you're a certain age, people qualify for that red, white, and blue card. And when I say messy, it just can be confusing because there's the ACOs, the HMOs, and Medicare supplements. But before we get into that, can we just talk about the basics to Medicare? We have Medicare A, B, C, and D. And most people know that A has been paid through our FICA taxes our entire lives. So, you don't pay a premium for that. But why don't you kind of dig into that a little bit?
Yeah, I mean, so you actually have A, B, C, D, E, and F. I mean, I'll go over briefly on each one of them. You have your Medicare A, which is your hospital insurance. So if you're 65 and up, and obviously you're eligible for Medicare services, if you're signed up and you have an emergency or something that requires hospitalization, this is where your Medicare Part A comes in. Mm-hmm. The Medicare Part A will also cover skilled nursing facilities, hospice care, and home health services. Your Medicare B, that's your medical insurance. Like, people who under 65 have Blue Cross Blue Shield, Cigna, United Health. Well, this basically takes over for that. And this would be your primary at 65 and up. There's a monthly premium, and it covers 80% of your cost after your deductible is met. So most patients will have to acquire an additional 20% insurance coverage to basically have the full 100% unless you sign up with a Medicare Advantage HMO plan, which we can get into a little bit later here.
Let's say you just say, hey, I'm going to get my Medicare A and B, keep that. I'm not going to get any gaps or supplemental coverage.
Yes.
With Part A, even though there's not a premium for Part A, mm-hmm. there is a deductible. I think 2025, the deductible is $1,676. So what they also say is that if you go in 6 different times throughout the year, you could pay that up to 6 times. So it can get costly, even though there's not a premium. And that's
Correct.
Why we're going to kind of turn the conversation into how do you cover that. And then Part B, you do pay a premium, right?
Yep.
And that's $185, I think.
That's
this year.
Yep. It's usually paid up. The first visit, most medical offices, whether it's a specialist or your PCP, will collect that $185, and obviously the month of January, February, whenever that first visit is, and that would cover that, and then you're covered. Yes, you've met your premium. You're good to go.
Right. So that's the deductible. So you have a $257 annual deductible plus your premium. And there are ways to cover your premium and your deductible, depending on what kind of insurances you have, which is interesting. Can you tell us a little bit more about C and D?
Yeah, sure. So C, this is where Medicare Advantage comes in, your private insurance companies. It would include A, B, and D. So, and that's where these Medicare Advantage plans come in, where a patient can now get away from avoiding that additional 20% and just sign up with one of these Medicare Advantage plans to encompass basically all of A, B, and D in one group. And therefore, you would not be responsible for having to find a separate policy to cover that 20%.
But there's a catch to it.
Oh, yes, there is a catch to it.
What's the catch?
Well, I'll also mention that usually these policies will also include vision, dental, and other wellness programs. Like a lot of these Medicare Advantage plans will have a dietary program, or a gym membership might be part of one of these wellness programs that we're talking about. Now, going back to the question of what is the potential downfall of signing on with one of these Medicare C plans, it's an HMO, okay? Most people know what an HMO and a PPO is. Bottom line there is the HMO, they will pretty much try and cover all of your care under one umbrella. A PPO is where you could go outside of that umbrella and you would still have coverage. When you sign on with a Medicare Part C Advantage plan, you'll be assigned to a primary, and this primary will be awarded the task of controlling pretty much most aspects of your health care. as far as what diagnostic tests will be ordered, what screening exams will be covered, and they will also be in complete control over any diagnostic exams that are ordered, even if these diagnostic exams are recommended from one of your specialists. Your primary care is also responsible for referring you to specialists. However, this group of specialists is somewhat limited. That's where you kind of come into the in-network provider and out-of-network provider. Well, these Medicare Advantage plans will have in-network specialists that your primary care will have access to.
So everything flows through the primary care who's on your Medicare Advantage card, whatever company you go with. And so they oversee everything, and everybody is in full circle, and they refer you out. By going to your primary care, most people pay a zero copay, so it's more affordable. But you can't always go see who you want when it comes to a specialist, because in that HMO, you're kind of captive to whoever's in the network.
Exactly.
So that's one of the catches to that, right?
Exactly. So someone who does not have many chronic medical conditions, who's fairly healthy, could easily get away with a plan like this and save themselves some time and money. Someone who has multiple chronic medical issues that requires the care of multiple specialists, it can get complicated because, as I referenced, everything has to go through the primary care.
We actually stopped offering Medicare Advantage plans in our office years ago because we were jumping through hoops for our clients, contacting primary care, helping them contact a specialist, finding out why they set the appointment and it wasn't ready to go, and then why they wouldn't accept them. It could be months sometimes. So we, after I think, 10 years of doing Medicare Advantage plans, I'm like, I'm done. The client is retired, they're on Medicare, they deserve better practice, they deserve better customer service. So we are hands down not doing it. We will refer you out to people who do offer it, like Blue Cross Blue Shield. We have partners like that, but we stick to straight Medicare supplements. I always say you get what you pay for,
Correct.
right?
Yes.
And even though I don't want to say free, it's lower cost, there's hoops. And one of the unexpected things that did happen is this prior authorization to get prescription drugs. Like somebody would get on, for example, United Healthcare. Maybe it was Freedom or WellCare or whatever. And all of a sudden they would stop taking their prescriptions. We'd have to get prior authorization. But to do that, they would make them try a whole nother drug and it wouldn't work. And then the prior authorization 90 days later would go through. But to put retirees through hoops like that was the most aggravating venture I've ever been through in this industry. So did you experience similar?
Absolutely. So over the last, 5, 6, 7 years, we've seen a lot more prior authorizations being requested from insurance companies across the board. I will refer to Medicare Advantage plans as a prior authorization on steroids.
Right.
That's literally what happens with that, where everything requires an authorization, usually through the primary care physician, which does require a lot more documentation and time on the primary care's part.
Now, you did say something positive. Like, I am a fan of a PPO. What's your take on a PPO?
PPOs are great. It allows your patient to go in and out of network. Most PPOs will allow you to see a specialist without even a referral from your primary care physician.
Right.
So it gives you a lot more freedom.
But it costs a little bit more, right?
Yes, it does. Yes,
Right.
Yes, it does.
A little bit bigger copays, a little bigger deductibles, but freedom of choice is what you're getting with that plan.
Correct. So for most of my patients, whether, part of a direct primary care service like myself or a concierge practice, us providers want to see a PPO because it gives our patients as much freedom to go have diagnostic tests where they want, see a specialist where and when they want. Yes.
So when I first got into this industry almost 20 years ago, people with a lot of wealth were going into HMOs and PPOs. And I'm like, well, why wouldn't you just get a Medicare supplement, pay a premium, go anywhere in the United States as long as it's medically covered? They're like, because we're healthy. And I'm like, well, what happens if you become unhealthy? Now you want to go to the Mayo Clinic and now you can't, right?
Yep.
And so understanding those provisions was key because when you turn 65, you get this one time in your entire life where you are guaranteed to get into any plan across the country you want without any underwriting. And if you have diabetes or back pain or heart issues, taking advantage of that is key. Even though you do have a 12-month window to change your mind, if you go with an Advantage plan, you can come back to that guaranteed level. But people miss it all the time. We both are fans of PPO, so we'll go with that. What about the Medicare supplement? Tell me about that.
So what I have noticed over the years is that most of my patients will have a commercial insurance plan that they've had obviously through a job or paid privately for a majority of their lifetime, especially from age 50 to 65. Usually they'll be offered a premium difference when they come into Medicare to continue that plan. And that plan will basically cover the 20% that their Medicare Part B will not cover. A lot of it depends on what chronic medical conditions they have, what specialists they're seeing. But the key driving factor in all of that, I'll tell you, do you know what that might be? Prescriptions.
Oh, correct. Okay.
So if a patient who's under 65 years of age is going into Medicare and they have a chronic medical condition that requires a prescription or prescriptions that are branded, more expensive, those prescriptions will pretty much help dictate what insurance premium, what insurance plan they're going to move forward with.
For a prescription drug plan, the RX
yes.
plan, right?
So what will happen is, typically when a Medicare patient wants to onboard Medicare, they'll go to an insurance representative. This insurance representative, one of the first things that they'll do is they'll ask, okay, what medical conditions do you have? Okay. And then they'll also ask, okay, how many specialists do you see? And then the next most important question is, what prescriptions are you currently taking? Okay. Because every patient wants to be reassured that they're going to be able to continue to get the same prescriptions they were getting, obviously at a reasonable cost. And if it's going to cost them, exactly how much. I have noticed that their patients' prescriptions have dictated most of where my patients will go as far as this is concerned.
It's interesting because we used to offer prescription drug plans, but there's so many. We thought it was unfair to say, okay, we're going to offer 3 out of the top 30 and go with that decision. Instead, we're like, you know what, let's not even offer it. Let's walk clients through it. Let's call Medicare, Social Security together, and then give them all your drugs, give them the milligrams, and then figure out what is the best plan for you. And instead of making a commission on the deal. And that was the best move for people.
Yeah, and that's where the D part comes in of A, B, C, and D. The D's the part of the prescription, but obviously, these insurance representatives, when you're onboarding with them, they're going to use this information to help you determine which is the best route, moving forward.
Right. So that was Medicare A, B, C, and D. It's a lot to unpack, and there is actually so much more to talk about when it comes to just those basics, and then the HMO versus the PPO versus the supplement. But when it comes to a Medicare supplement, I mean, there's a Blue Cross Blue Shield, there's Humana, there's United Healthcare, AARP, and I'm going to tell you all this much. They all have to cover exactly the same thing. The only difference is the title at the top. So if you get the N plan with United Healthcare, the N plan with Blue Cross, or the N plan with Humana, that G plan or the N plan, they're identical. So I also say shop the market. Like we use United American. It's one of the lowest costs, and it covers the exact same thing as all these other companies. And what we look at when it comes to companies is how fast are they going to inflate your premium over all these years. And United American has been amazing. I mean, we do Mass Mutual, we do them all. There's like 27 of them we're signed up with. But we always say, go with the lowest cost because they're good companies and they've all been here the same amount of time, basically, right?
Yeah.
Is that your experience?
Yes. And I think working with an insurance representative that offers all different types of insurance programs is the best way to go. You see a lot more offices, representatives that focus on mostly these Medicare Advantage plans, and
they pay more. That's why.
Well, these representatives are doing what they can to sign up with one of their policies. Okay, so they're very narrow-minded. Okay, they're not giving you many options. You want to onboard your Medicare experience with somebody that's experienced, well-versed in the whole spectrum of all the different insurance options.
Correct.
Not somebody that's going to focus you into one of these particular plans walking in the door. I do not recommend that any patients go or begin this process in such a narrowed focus of these insurance companies moving. They want somebody that's well-versed, been doing it for a long time, and knows a little bit about a lot of different insurance companies.
So buyer beware. They sound good, smell good, and look good. Doesn't mean they're good. No. Check their portfolio and see how many plans they're actually working with. And if you're not sure who those people are, we can definitely refer you out to some really high caliber Medicare people in town for sure. Now, Rob, there's been changes with Medicare, and especially with the Medicare Advantage plans, there's going to be bigger and higher costs to the people inside of them. So why would anybody even use a Medicare Advantage plan or an HMO if the costs are going to get higher for that individual when you can just get the supplement and go anywhere, anyhow, any state, any city, as long as it's medically necessary?
I think a lot of it has to do with that 20%. They don't want to have to deal with it. These Medicare Advantage plans are, simplified where you can just join them and not have to worry about the extra stuff that you have to add on to cover yourself, 100% adequately as far as your health moving forward.
Well, and the other thing, there's commercials on those Advantage plans. Hey, we'll pay your Part B premium at $185. And so there's companies out there that will do that. And then there's other companies that will do it based on if you have diabetes or COPD. So it's based on ailments also. And those are an option. But remember, those are the HMOs. You're going to jump through hoops and pull your hair out. I bet you within short order. So give it 6 months.
They're going to give you money to go to the pharmacy every single month. They're going to give you money to go to the gym every single month. A lot of other things that they offer, which are great.
Yeah, they're great.
But I think that's, part of, the whole lore, that kind of like the bait.
What sounds too good to be true sometimes can be too good to be true? Okay.
Correct. Yes.
So tell us about some of the changes that we might see on the horizon with Medicare.
Physicians are being incentivized when they are cutting costs, and that's where I think the biggest problem is. And I think this is where we're hurting our patients.
So tell us more about that. What are doctors getting paid for every person who's on an HMO and they pick that primary care?
So
you want
physicians,
me to say it?
I'll say it. Okay. Physicians and businesses that come together to work in these ACO HMOs, they are incentivized, bonused to save costs. And in healthcare, if and whenever you try and save costs, the only one that's going to hurt and suffer here is the patient. And I personally feel that there's a little too much of this going on right now. And just as if anybody else, whether outside of healthcare, any business person, if they're incentivized, obviously they're going to change their mood. They're going to change their directives on how they practice, how they do business, to put more money in their pocket. Too much of this is happening right now. I believe that certain providers are losing focus on the patient care and building more focus on what else I can do to generate more money from my practice. And like I said, this is hurting the patient. I think we need to try and get away from that and not incentivize as much.
Which is, I think, about to happen soon, right?
Yes.
And let's turn the positive tune here. There's a lot of great doctors out there. They're taking the Medicare supplements. They're taking some of the Advantage plans. They got a nice portfolio so that you have choices. Some might pay them more than others, but there are some offices where they will only take Medicare Advantage plans. And I think basically based on what you just said.
That you hit the nail right on the head. And right now, if things were to continue the way they're going right now, you're going to see a lot more of those.
Well, and the other key part is that when people get to choose between October 7th to December 7th or 15th to the 7th, that your provider might be in the book. But come next year, January 1st, they might not be in the book. And then you are stuck in that plan 90% of the time, and you can't switch back. So always call your doctors before you're switching plans and make sure they'll be in there the following year. That's been a big headache.
And unfortunately, and listen, and I'm going to say this right now, I'm not everybody is like this, and this isn't in every hospital and every provider, but it is not uncommon that when these Medicare HMO patients hit the hospital, the provider that's assigned to them obviously knows that this is an HMO. They are doing what they can to get that patient out of the hospital as quick as possible.
Is that the term, quicker and sicker? Yeah. And so when you have a Medicare supplement, that's not the case?
So, no.
It's like a private equity firm coming in and firing and cutting costs so they can profit. Okay, well there you go. Circling it back to
Well,
finances.
I'm sure all of us here have at one point seen a hospital bill
Yes.
before. It's not cheap. And obviously when a patient goes into the hospital, if some of these HMO plans are able to cut costs and savings by preventing a patient from having to spend as much time in a very expensive facility, they're going to try and do that.
Well, Rob, you have given us so much information, lots of data. People just need to hear about it so that they are making better decisions as they're aging into good old Medicare, which we love. Medicare is an amazing healthcare program. Just picking the right plan within it, I think, is key, right? Now, you work with people who are Medicare, people who don't have Medicare, all ages. How do people get a hold of you? Because your specialty is a little bit different. Like you. Go over your specialty real quick before we close out.
So I started my own direct primary care practice last March, and direct primary care is basically just a step below concierge medicine. Most patients have heard about concierge medicine, but basically the sum and substance is you pay, a certain fee, whether an annual fee or a monthly fee, to have access to me. And obviously I'm not the only direct primary care practice around here, but direct primary care practices and concierge practices are becoming more popular, and also because of the system that we've created here. Part of that is the Medicare system, where providers, particularly primary care providers, don't have enough time to spend with their patients. So the best scenario for me was to not have to rely on that and go into an arena like concierge or direct primary care where I can spend as much time with my patient as possible. My onboarding visit is usually anywhere between an hour and a half, sometimes 2 hours, as long as it takes.
That's amazing, because that doesn't happen with most onboarding visits.
No. Most, if you go to one of these, offices that see mostly these Medicare MHMO, 15 minutes, 30 minutes tops that you'll have, with your provider and or, nurse, medical assistant, whatnot. So it's just impossible to cover all aspects of medical care, mental health in just that period of time. So hence, a provider that specializes in concierge or direct primary care like myself, adding us on top of one of these Medicare plans or commercial plans is an option, and it's a safe net.
Especially if somebody's traveling a lot. Right? Our clients are always traveling, and all I know is when I call, you guys answer, and if I need a prescription drug for a cracked lip or a hurt leg or some rash on my arm, it doesn't matter what state I'm in, you guys are like, okay, next door to you is your prescription pharmacy, right?
Yep,
like you guys are fantastic.
24/7 access, text messaging app that you can send a message to us at any time during the day. That's important, especially in the arena of Medicare. When patients, obviously it's important to, when they get sick, to be on top of it. One of the more common diagnoses that Medicare patients end up in the hospital for is pneumonia. And pneumonia can easily be treated, especially if we know about your symptoms, within the first 48 to 72 hours. Which obviously I have no problem, treating my patients as long as they let me know what's going on. If we can't get them, typically we can get our patients within 24 hours, but the conversation has already started right away. Sending antibiotics, come to the office, whatever we have to do to get them pointed in the right direction.
Well, our entire family is with you, and we have staff as well. You guys do back up what you say, so we appreciate you. Now, if anybody wants to get a hold of you after this, they go to robmain, MAIN, health.com, robmainhealth.com. But do you have a phone number they can reach you at?
Yeah, 352-282-0010.
All right, great. So if you have Medicare questions about A, B, C, and D, and or about Medicare supplements, just reach out to us. If you're looking for a new doctor or a different type of service, you just reach out to Rob Main. He's quite fabulous. And thank you so much for coming in and doing this Medicare episode.
Anytime.
It's so important. So many changes. I can't keep up with it.
It is important stuff. So, I appreciate the time once again.
Thank you. Appreciate it.
Thanks for listening to the Retirement Coffee Talk podcast. If you have questions or would like to begin the process of building a tailored retirement plan, call Zinnia Wealth at 833-368-3680 or find us online at zinniawealth.com.
Zinnia Wealth Advisory, LLC, and Zinnia Wealth Management, LLC are affiliated entities. The information presented is believed to be current. It should not be viewed as personalized investment advice. All expressions of opinion reflect the judgment of the presenter on the date of the podcast and are subject to change. Any legal or tax information provided in this podcast is general in nature. Always consult an attorney or tax professional regarding your specific legal or tax situation. Any client experience discussed on this show are unique to that client.